President Joe Biden has made an ambitious plan to vaccinate millions of Americans.
His administration is boosting vaccine purchasing with hopes to deliver enough to protect 300 million Americans by the end of the summer. And to get that done, the federal government is buying 200 million more doses combined of the Pfizer and Moderna vaccines. Well, this comes while there are many complaints about a massive shortage of vaccines. As the president makes that commitment, we're drilling down on the state of Missouri, asking them where the vaccines are and who's getting them.
Tonight, Walgreens and CVS both tell News 4 they gave them 332,000 doses, and the state now says the pharmacies have only been able to administer 17% of that, and they don't need the rest. So questions arise. Where are the other doses and where will they go? This takes us to our team coverage tracking the vaccine from Missouri to Illinois. We begin with Emma Hogue working to find out where those unused doses are going.
Kind of come from the perspective that Missouri is supposed to be the show me state. And to me, that infers we are supposed to be the leaders in best practices. And that doesn't seem to be happening with the COVID-19 vaccine.
72-year-old Sue Urso signed up with several hospitals and her health department, but is still waiting to get the vaccine. Frustration comes after hearing her friends and family in other states are further along.
I was just recently on a Skype with a number of my cousins that are in different states, everywhere from New Mexico, Ohio, Virginia, and all of them had either gotten their first shot or they were scheduled to get their first shot this week.
News 4 uncovered CVS and Walgreens are still vaccinating residents and staff members in long-term care facilities and can't move on to other categories. The state of Missouri says it allocated 332,000 doses to Walgreens and CVS for those facilities under the federal pharmacy program, but only 17% of those shots have been administered.
Again, why? I mean, as you say, they have had months to plan this. They knew this was coming.
Tonight, both CVS and Walgreens say the state overestimated the number of doses needed, basing it off of maximum occupancy at each long-term care facility when not every facility is full. CVS also reporting nearly 50% of staff members within those facilities are declining to get the vaccine.
It's about saving lives. Basically, I had a friend whose husband passed away last month from COVID. It was devastating, absolutely devastating.
Like many, Urso wonders where the leftover doses are going. She hopes they're benefiting others who are vulnerable and at risk of dying of COVID-19.
Our state just hasn't seemed to risen to the occasion of the desperate need in our state.
I asked CVS what happens to the leftover doses. They tell me typically they are brought to another facility and given to an eligible population. CVS says it is rare, but there are some cases where doses expire and they're thrown out. I asked how many in our area have been thrown out, but tonight I am still waiting on a response. Reporting in Clayton tonight, Emma Hogue, News 4.
And News 4 has been doing some digging to see how Missouri compares with other state shipments. And after crunching the numbers, we found it appears the state is receiving less vaccine from the federal government compared to other states in our region. So let's check it out. Missouri only has enough doses to vaccinate 10.9% of the state's population once. Illinois just a little bit higher, receiving enough to vaccinate about 12.2% of their residents once. As for Arkansas to our south, the state has enough doses for 13.1% of their population.